We are here today to talk with legislators about 3 different really important public health issues. First, we asked our legislators to defend the Freedom to Breathe Act. Second, we want to protect kids from candy-flavored cigarettes and little cigars. And third, we got to raise the price of tobacco because we know it's the #1 thing we can do to reduce teen smoking.
I think it's important for people to be involved in Day at the Capitol, especially all the youth we brought, because they need to know that they have a voice in this house.
You get to meet senators, you get to experience this whole trip, and you get to voice your opinion on certain things that you wouldn't be able to do otherwise.
I think it's really great to have the young folks here because they're the ones who can really change the numbers in terms of how many people are smoking. They're the ones who are still non-smokers and we don't want them to start, so this is where prevention really needs to start.
The most important thing is to really contact your legislators. They need to hear from the experts who are their constituents to know what's on people's minds and to get the information to make good decisions. That's what they're here to do, is make those decisions.
I'm really excited to go to the Capitol today and talk to our senators and representatives because I have a lot of friends who smoke and it's starting to kind of take over their lives.
A future generation that will have a say in how they will be a part of the system and how interactive they will be part of the future. So our youth needs to make sure the representatives here know that they're coming up and they will be voting as well.
554 means the price that every man, woman, and child in the state of Minnesota pays for the excess healthcare costs related to tobacco.
Day of the Capitol is an excellent opportunity for our folks to come in from all over the state, meet with their elected officials and talk about the issues that are important to our organization, which is really reducing the incidence and mortality of cancer.
Tobacco use, as you're well aware, is the #1 public health problem in the country, and it's the #1 public health problem in Minnesota. We want to be a healthy state. We want kids to be healthy, we want adults to be healthy, we want our state to be healthy.
Really, when you look at tobacco cessation, it's a 3-pronged approach. #1, smoke-free workplaces, smoke-free environment. We have that with the Freedom to Breathe Act. #2 is education and prevention. And #3 is raising the price of tobacco products.
Outside of the Capitol, I think people need to just talk to their friends, their neighbors, the people in their family to say, tobacco use is affecting us. It's affecting our health, it's affecting our communities, it's affecting our pocketbooks.
It's important that we come back to the Capitol every year, every session, to talk about tobacco's harm because we know public policy is the #1 thing we can do to reduce teen smoking and help current smokers quit. It's so important that we don't take this session off because we know the tobacco industry is, and they're going to be here watching and waiting and working their issues, so we need to be here as well.